A new poll from the University of Michigan shows that 1/3 of parents have no plans to get their children vaccinated for the flu this year.
And 2/3 don't feel a flu shot is important, despite the push for everyone to get vaccinated during the pandemic. Joining us now is our chief health editor, Dr. Nandi. Doctor, do we know why so many parents are skipping the flu shot for their kids? Is it just the noise that's out there about this whole issue?
Yes, David, and I'm really concerned about this. I think it's the noise and others, and I'll go into it. The poll was released today by Michigan Medicine CS Mott Children's Hospital. It's a national poll, and over 2,000 parents with kids between the ages of 2 and 18 participated. Now, as to why 1/3 of patients are skipping the flu shots for their kids, here are the most common reasons. Number one, 42% were concerned about the side effects from the flu vaccine. 40% felt that the flu shot was not necessary. 32% felt it's not effective. And 14%, Dave, are worried about getting infected with COVID-19 while at a healthcare site. So all of these are concerning reasons for not getting it.
Yeah, and of course you're a parent, also a physician at the same time. I mean, what would you like to tell those parents out there who are listening and still at this point considering skipping the flu shot this year?
Samira, I'm a parent. I have 4 children, and I can tell you I 100% support vaccination. Tomorrow, all of my kids are going to get the flu shot. I'll repeat, tomorrow they're all going to get the flu shot. Now, as far as what to tell parents, first of all, when it comes to side effects, right, the most common ones are soreness where the shot was given, headache, fever, nausea, and muscle aches, right? It's not super serious. If kids get any of these, they're typically mild and don't last very long. Now, when it comes to safety, there have been hundreds of millions of people who have received flu shots. So lots of folks, and there have been a lot of research, tons of it in fact. And flu vaccines have a very good safety record. And when it comes to effectiveness, yes, it can vary from year to year. So it's possible that your child could still get sick. But however, this is important. Studies have shown that flu vaccination can reduce the severity of illness. And lastly, for parents who are concerned about going to doctor's office, please reach out to them because they'll have COVID-19 precautions in place. My pediatrician's office definitely does.
All right, so severity not a major concern or shouldn't be, but how dangerous is the flu for children?
So here's the thing, Dave. Children can die from the flu. We need to remember that. Last year, there were 188 pediatric deaths reported. 6 of those are from Michigan to be preventable, right? Plus, kids can suffer from serious complications like swelling of the brain, pneumonia. Also, dehydration can also be deadly if not treated properly.
And Dr. Nandi, when is the best time for kids to get the flu shot? I had been hearing as early as possible from now, but then, of course, it depends on when the flu season is expected to peak. So does it make sense to wait?
I would suggest, Amira, that everybody who's over the age of 6 months get the flu shot before the end of October. My kids are getting it tomorrow. It doesn't mean you have to get it tomorrow, but before the end of October. Flu and COVID symptoms, remember, are very similar. So we would end up with extremely long lines for COVID tests, and we certainly don't want to overwhelm our hospitals with both flu and COVID-19 patients. Even if we didn't have COVID-19, I would still be preaching the same story. Please get vaccinated. Let's prevent this illness as much as possible.
Good advice as always. I'm getting my flu shot this week, Doc. So
that's awesome news, Dave. Thank you.
Thumbs up with that. We appreciate all the good information you provide each and every day.
My pleasure.
All right.